When the hospital emergency room is inundated with knee-deep water when Superstorm Sandy pushed a wall of seawater through South Brooklyn up Ocean Parkway toward Coney Island Hospital, staff in the emergency room, less than a mile from the iconic boardwalk, had only a few minutes to evacuate dozens of patients. The water soon met their knees, and hospital employees used buckets to fight off the storm's surge. The gushing ocean drowned the hospital's boilers and servers, shutting off the electrical supply and emergency power. More than 150,000 square feet of the hospital, which serves more than 850,000 people a year, sat underwater. In a matter of hours, the flood from Superstorm Sandy, the largest Atlantic hurricane on record, had forced the hospital to shutter. And for 3 months, it stayed that way. But thousands of people who still lived nearby needed medical care. Staff set up triage services for patients who required immediate attention and diverted everyone else to nearby hospitals, many of which were also damaged by the storm. When they reopened, staff found sand in the hallways. Nearly a decade after that late October storm in 2012, Coney Island Hospital and the people it serves are still recovering.
Experts predict that human-driven climate change will significantly increase the number of communities vulnerable to flooding, how often disasters such as Superstorm Sandy occur, and the devastating extent of the damage. Unless dramatic action is taken by world leaders to mitigate these effects, climate change will also undermine the healthcare systems that support cities and towns already in harm's way. Chart by Megan McGrew, PBS NewsHour. We're very good about responding to crises, said Doug Farquhar, Director of Governmental Affairs for the National Environmental Health Association. We're terrible about finding money for the day-to-day environmental work that we need to mitigate these problems in the first place. Since it was established in 1875, the hospital has been flooded several times by nor'easters and hurricanes, such as Irene in 2011 and, in recent weeks, Ida. But damages from those events were nowhere near as bad as Superstorm Sandy, said Svetlana Lipyanskaya, who joined the NYC Health and Hospitals Coney Island in 2019 as chief executive. In South Brooklyn, the effects of that storm and climate change are ongoing, she said, having traumatized many who still talk about Sandy and its aftermath as if it just happened. Floods can hurt a healthcare system in different ways. The actual buildings can be rendered unusable by rising waters, the utilities that keep the lights working and water running can be shut off, or the roads around the facilities can be cut off by rising water, making it difficult for people to get the help they need when they need it, not only in the moment, but in the weeks and months that follow, said John McCumber, a senior lecturer at Harvard Business School who has studied outcomes when investments are made to boost infrastructure resilience. In other words, storms happen, but they don't go away, Lipyanskaya said. Coney Island Hospital might be particularly vulnerable to flooding, given its proximity to the coastline. But communities outside of the areas usually hit hardest by these storms might also be at risk, and not even know it. And the risk is likely to change and grow in the coming years. Flooding is the most frequent type of severe weather-related disaster in the U.S. Every 5 years, the Federal Emergency Management Agency works with local community leaders to maintain and update the nation's flood maps. The process, however, is often bogged down by bureaucratic back and forth. When the federal government alerts local communities that they live in a floodplain, that news can discourage developers and economic growth, so local residents often file appeals. And no matter whether someone's protest is ultimately successful, the proceedings can be delayed for years, said Dr. Ed Kearns, Chief Data Officer for the First Street Foundation, a nonprofit research group dedicated to quantifying flood risk for American households. There are people who are living in harm's way today that have significant risk of flooding, and they don't know it, Kearns said. Eventually, these findings are stored in the National Flood Hazard Layer, a database intended to illustrate flood risk accurately and to inform the National Flood Insurance Program, which Congress created in 1968 to protect properties in areas prone to rising waters, including hospitals. According to FEMA, when floodwaters rise 3.5 feet, that is high enough to knock a hospital out of action, Kearns said. The program's debt has grown, along with the number of properties that have flooded at least twice in a decade, up from about 150,000 in 2009 to roughly 200,000 in 2018, according to a 2020 study from the Government Accountability Office. Besides delays, other hurdles might prevent residents from knowing they are at risk. The maps don't cover the whole country. About 40% of the US is unmapped because assessing each river basin in the US would take more time and money than FEMA can currently allot. Some communities only have paper copies, not digital, which are sometimes stashed away in a municipal building, Kearns said. Typically, these maps focus on floodplains around rivers, creeks and other stable bodies of water, not accounting for flooding caused by heavy rainfall or the effects of climate change, he said. In January, the National Resources Defense Council and the Association of State Floodplain Managers petitioned FEMA to update their maps to adequately account for increased flood risk due to climate change. In recent weeks, FEMA issued a call for public comment about how to transform the National Flood Insurance Program's community ratings system so that it might better align with the current understanding of flood risk and flood risk approaches and put greater responsibility on local communities to manage and reduce their flood risk. In 2017, the Department of Homeland Security's Office of the Inspector General criticized the nation's flood maps as too often being outdated and incorrect. FEMA needs to improve its management and oversight of flood mapping projects to achieve or reassess its program goals and ensure the production of timely and accurate flood maps, the report's authors wrote. 4 years later, experts still were wringing their hands over how badly out of date FEMA's flood maps remained, saying the billions needed to update those maps could prevent far greater costs in flood damage.
Thank you for watching. Please subscribe.